So we're going to talk about RSD today. So the first thing I want to say about RSD is it is a real, experience, but it is not a diagnosis. So you can have, sort of this rejection sensitivity dysphoria, but it's not a separate diagnosis in and of itself. It usually the symptoms of RSD come along with other diagnoses, whether it's bipolar or anxiety or depression. So I want to get that on the table first because I think it's a little confusing. Lindsay says, I've read that RSD only lasts for a short period of time, but when I feel rejected, I'm affected by it for weeks. Is anyone else this way? So I think when Lindsay, again, I feel like RSD, um, is a little bit of misleading because yes, I think that people with ADHD are sensitive to rejection, and I think it's because you've experienced a lot of rejection, you've experienced a lot of disappointment, and so the rejection is felt intensely and affected for weeks, and I think that really has to do with the challenges with emotional regulation that come along with having ADHD. So, when people with ADHD are hit with rejection, they are hit hard, and it's hard to recover. So yes, a lot of people are that way, not just you. Um, okay. Carmen, I don't know if it's my kid or if it's part the ADHD or something else, but my son cannot lose. He has to be perfect on everything, otherwise he has a meltdown. He's 10. On 10 milligrams of Vyvanse. For example, we're studying the order of operations. He isn't getting them right because he's not listening to me on how to do it. So instantly it's, I wish I was someone else. Everyone gets everything right. Everyone else gets everything right. I'm failing. Well, Carmen, thank you so much for sharing that. So a lot of kids with ADHD struggle with um, losing, and or what I call, this perfectionism. And they want to be perfect. They want to get things right all the time because they have received so much information about how they get things wrong. I was reading an article on rejection sensitivity dysphoria to prepare for today, and I read this horrible statement which said, I have to tell you because it was unbelievable. Sometimes the criticism or rejection is imagined, but not always. ADHD researchers estimate that by age 12, children with ADHD get 20,000 more negative messages about themselves than other kids their age. And all that criticism can, of course, take a toll on their self-esteem. So I looked for the citation for the 20,000, but I didn't find it. So I'm going to search it and I'll get back to you about that. But I think that wanting to get everything right is a way to sort of fend off the real kind of vigilance, hypervigilance, and criticism that kids with ADHD live with all the time. When am I going to mess up? And I didn't know I was doing something wrong. When am I going to disappoint people? When am I going to disappoint myself? When am I going to have an uncomfortable social or academic interaction or situation that I don't know how to cope with? And so I think perfectionism, by doing everything right, is an attempt to say, well, if I can't do it perfectly, I'm not going to do it. And I call that perfectionism procrastination. So what he's telling you is everyone else gets everything right. I'm failing. He can't hold on to the times when he's successful. And this happens a lot for kids with ADHD. And so what I think it would be important to do in this situation is to start to write down some of the successes. And, just like, or sit down at dinner and say, what are 3 good things that happened in your day today? I have I talked to one mother and she says she does a happy and a crappy at dinner every night, which I love. Maybe we need to do 2 happies and a crappy. Dr. Barbara Fredrickson and her team at the University of Pennsylvania did a lot of research on happiness with Dr. Martin Seligman. And what they found is, excuse me, I forgot to turn my phone off. What they found is that the ideal positivity ratio should be 3 positives to 1 negative. And given the information that I just read to you and what I've heard from people all around the world, is that their experience of kids is anywhere from 1 positive to 10 negatives, Or kids themselves. One teenage girl said, "Well, Dr. Sharon, is this what other people tell me or what I tell myself?" And I said, "Well, both." And she said, "Then it's probably 1 to 30." So, this will create or the environment for this kind of rejection sensitivity, not just because you kids are criticizing themselves, but because they feel that criticism from other people. Annalise says, my RSD can last for months, years. I find myself ruminating over lots of things. My daughter has the same, and I'd love her to open up to new friendships after being rejected by her friend group about 3 years ago. Wow, that sounds hard, Annalise. How old is your daughter? I'm curious, because I think that, depending on the age when you experience this kind of peer rejection, kids can bounce back differently. If it happens when you're 13, it's different than when you're 8. 8-year-olds are a little more resilient in terms of finding other friends. And 13-year-olds, are in the thick of that social soup that middle school gives us. Amanda, I never realized that this was part of ADHD. I was diagnosed as an adult. The perfectionism, procrastination, and um, rejection sensitivity are a huge problem for me. Have studies shown any particular medication or behavior modification to work? Um, Hold on a second. Have studies shown that? So I'm not aware of particular studies. I think that certainly what may help is a combination of medication for a serotonin reuptake and a selective serotonin reuptake inhibitor or something around serotonin. So that would be worth talking to your doctor, whether it's Prozac, Zoloft, Lexapro, Celexa, or something that can actually really directly target the mood, as well as some ADHD medication, or maybe just ADHD medication will assist your brain stew enough to kind of help you rally better. Brooke asks, I'm most interested in how to pause and direct the intense feelings of shame and self-loathing that come during an RSD episode. Yeah, that can be pretty horrible. Um, so, you know, I am a super fan of Brene Brown, and she has a great podcast, by the way. And she has one of the episodes is about shame. And of course, the difference between shame and guilt is that shame, uh, um, is something that we are bad, versus guilt. We've done something bad, I guess, if you have to use good and bad. So we want to kind of avoid that shame spiral. And I know, I've had some shame spirals myself, and they really are awful. And I think that comes from a history of being in a family where you may have been shamed, or where people blame you for things that happen in your life. And that can't feel good. And so what we want to do is we really need to try to notice when we're in a shame spiral and have um, some go-to uh, choices. So whether that choice is I'm going to call so and so, whether that choice is I'm going to create a playlist of songs that make me feel happy, and I'm going to press that button. I'm going to go for a run. I'm going to go for a walk. We want to get ourselves out of that spiral as much as we can, and only we can do that. Only you can do that for yourself. I can tell you how great you are, but if your internal monologue is, I actually suck, Dr. Sharon doesn't really know that, then that's not going to help you. So what I want to encourage you to do is to, when you're not in a shame spiral, to write down some things that you like about yourself. The other thing that can be really helpful, and I did mention, saying something at the dinner table, but for people who are older, particularly for teenagers or adults, if they can do it, I encourage you to keep a journal where at the end of the day you write down 3 positive things about the day. And they don't have to be like fabulous. You didn't have to discover a cure for cancer. It can be, I liked my outfit. had a good breakfast, or I gave a good presentation at work. I was patient with my child. It can be anything, but part of the exercise of having these three things is so that when you're in a shame spiral, you can go back and remind yourself of times when you were doing well, when you were able um, to succeed in your life in the way that you think is important. It's important to remember that anxiety and some of RSD, the rejection sensitivity, is of course related to that, because there's anxiety. What are people thinking of me? You know, how am I doing? Anxiety brings amnesia for our successes in the past. And so this exercise of writing three good things down counteracts that. It's also been found to sort of fend off depression, and the dysphoria with rejection sensitivity dysphoria is a type of low-level depression. Um, um, Thank you, Annalise. She's 17. So yeah, when you're rejected by a friend group as an adolescent, it's very difficult. And adolescents can be particularly cruel to each other. Developmentally, the task of adolescence is to figure out who you are and where you belong. And if you're shunned by a group, um, and kids in high school can be very mean, it's hard to recover from that. And yet, I hope that she's found some other friends. Um, I kind of want to tell you this rejection story, but from my own life, if that's okay. So if it's not okay, sorry, but I'm going to tell you anyway. So when I was in my, 40s, late 40s, maybe early 40s, my son he was on his travel soccer team, and I live in one town, and most of the kids from this team lived in other towns. And there was a weekend um, soccer tournament. So we drove down to Cape Cod and we stayed in this motel. And the first day, several games, and I had my son and two other boys, because the fathers had decided to go off and play tennis. Great. So I have the boys. So I go up to this group of women who all know each other because A, their kids have been in this team longer, and B, they live closer in another area, like 30, 40 minutes away from where I live. So I went up to them, to one of them. They were all sort of standing around. I said, "Hey, what are you guys doing? I'd love to join you." And she said, "Oh, well, we're figuring it out." And then I stood there for like 5 minutes. No one acknowledged me. And then I tapped the one woman on the shoulder, said, "Hey, I'm just wondering, can we join you?" And she looked right at me and she said, "We all don't have to do the same thing." And that was just really uncalled for. I mean, I'm in my 40s. What am I? It was like being 13. And so I went and I found another mom who also didn't know this group, and we got together, and then we found a third and fourth. We sort of formed our own little subgroup. And then the people in the dominant group wanted to talk to us. But it just brought back all of that rejection, and I think I've shared that I was bullied at one point. And so it just feels terrible, and you carry that along with you. But the difference was that I was in my 40s, and I was like, are you kidding me? It's harder to do that when you're a kid. And it's hard to remember how to do that even when you're in the middle of that. Like, that stuck with me. I mean, here it is like 12 years later, and it still bothers me. So it's hard. Rejection is really hard. Kelsey says, "Amanda, me too. It's definitely something that's plagued my life in both work, school, and home life. When I make a minor mistake at work, it will kill me. Being in tears for hours for messing up a report or getting disappointed in myself. Doesn't make it easier to be at home with nothing keeping me in check, with no people around." Oh, Kelsey, I want to wrap you in my arms and give you a huge hug. Brene Brown talks about this. We have to be kinder to ourselves. If I say to people, if you wouldn't say it to a third grader, don't say it to yourself. And so we need to come up with times when we notice that we're saying something, have a book of inspirational quotes. Cheryl Strayed has a great book of a book of quotes. I can't recall the name right now, but you open it up and every page is a new, nice sort of thought to turn things on its head. We have to develop tools to deal with our the kind of flooding you're talking about when something doesn't go right, because um, it's not a reflection on you. It's really, people make mistakes. And one of the problems for people with ADHD is they have this fixed mindset. I am this way. I cannot change. Instead of a growth mindset, which is like, okay, well, I tried. It didn't work. I'm going to regroup. I'll try something else. So there's a lot of comments. Ashley says, I'm an adult with ADHD and RSD. I have overcome a lot this year, but now I have become nervous and anxious about a new position I'm about to start on Monday. Bravo. I am confident I can do the job. I worry about my time management, especially getting to work on time. I am going from freelance contract work back to corporate. My BF has not been encouraging and keeps reminding me of my screw ups in the past. Ouch! Ouch! I'm fighting not to allow negativity to affect me, but as the time gets closer, I'm getting worried. All right, Ashley, here you go. Listen to me. You have a growth mindset. You've made some mistakes in the past. You've learned from them. You will make mistakes in the future and you will learn from those. If your boyfriend isn't or not giving you the kind of encouragement you need, a conversation like this has to go. Dude, if it's not nice, don't say it. Period. You're not helping me. You're supposed to be my support system. So I want to say to you, if you're going to have trouble with your time management, great, get some support around it. Look at the attitude articles and videos on time management. Set up a system for yourself. Use alarms, use alerts. You can do this. You've got it. Good luck, and tune in come join me in a week or so I can hear what happens. Dana. Thank you, Dana. Beth, how is it best to differentiate general anxiety disorder to rejection sensitivity when explaining ADHD and its effect to your friends? So, a generalized anxiety disorder is different from rejection sensitivity. And I think anxious people are more sensitive to all kinds of things in their environment. Particularly rejection, because part of the anxiety is about things going well and if it's going to be okay. So, anxiety is something that, has to do with, it's a physiological response to a particular trigger. Worried thinking leads to you have trigger, then you have worried thinking, then you have the physiological response, and then you have the cognitive beliefs that set in. Rejection sensitivity is much more, for lack of a better word, it's kind of localized. And so essentially, you can take information, you can take medication. I'm not a physician, so I can't say, but essentially, what you want, what the people, one of the traits of having this condition is that, your social withdrawal could look like social phobia. Trying to stay out of situations where you get hurt could look like anxiety. So we want to sort of, I feel like, again, rejection sensitivity disorder is subsumed under the general anxiety diagnosis because there is no diagnosis for rejection sensitivity. I think it can fuel anxiety. Angela, unbelievable that those parents would do that to you. I know, right? It was incredible. Mary, you've been there with travel sports teams. So much for women supporting women. Thanks, Mary. Thanks, everybody. I've moved on. I get to be here with you today, and they're certainly not. Amanda, thank you. I suppose I should mention I also have OCD and I'm in 8-year recovery from bulimia. No episodes. Yay! That's incredible. It is really hard to recover from eating disorders, particularly bulimia. Fabulous. Taking Prozac and Mideas usually works well, but sometimes there are side effects. Yeah. Prozac did not work. So that's great. You want to find the medication that works. So it's important that you work with a prescriber with whom you feel safe and who you trust. Robin, women at any age can be mean. Yeah, true. Brooke, another problem I've encountered with this is I worry my extreme reaction to messing up comes across as being manipulative when I really struggle. Look, I come from a long line of neurotic Jewish women. We have big feelings. And I have big reactions to things I wish I didn't. And I've certainly learned how to deal with them over time. It's my life path. I don't expect myself not to react. What I hope is that I can like feel like I have my hand on the volume and control the intensity control. And so that if I'm having an intense reaction, I know how to manage that better than I did 10 years ago. I know how to take a walk or listen to music or do an insight meditation or a headspace, SOS. I love the headspace SOS. It's fantastic. So, if you don't know what Headspace SOS is, check out the Headspace app on your phone, and they have a little SOS thing for the emergencies. So the issue is how you manage it, not making it go away. Dana, I know, and it's horrible, but people can really suck. I can't believe how adults are entitled to be so above others. It's nice that we at least are nice people. There you go, Dana. Dana. Genevieve, adult son, ADHD. I think he has RSD. I think I did quite a good job as a parent. Any mistakes I made, he is fixated on them and refuses to speak to me. What can I do? Oh, I feel for you. So, I think the best thing we can all do as parents is be accountable. We're doing the best we can with the resources we have available and the legacy that we bring to our parenting. I I made mistakes with my kids, and yes, they have certainly told me about them, and yes, that has been really painful. And all I could do was say, I did that. I'm sorry, I'm trying to do better. And I am trying to do better, and they see that. So I think, if your son refuses to speak to you, he's not giving you a chance anymore. And so I would really want to know from him what would need to happen for you to have some kind of relationship. May not be super close, but ideally you'd want to have some kind of relationship, I'm sure. Good luck. Oh, yes. Thank you, Annie. Brave Enough, Cheryl Strayed. I love this book. I keep it at my desk at work. Like if I'm writing and I'm feeling kind of, I don't have a good idea. I open it, I say it to myself. This is a great book to read every day. You just open it up and there's something to tell yourself. I love this book. Thank you, Annie. Let's see. Lori, I went through this with my son during his teens. I acknowledged his feelings, apologized for not being what he needed me to be, and we were finally able to move past it. I don't know if that is what recommended, but I'm sharing because it worked. It worked for us. Yes, that's exactly what I'm sharing. Sometimes as parents, our job is to carry the load. And so, your memory of something that happened may be very different than what your child remembers. But, their memory is their memory. We cannot do anything with that. We can just say, this is what I remember. I hear this is what you remember. And I'm just sorry that it happened and what I did to make that happen. Genevieve, okay, great. I'm sorry that hasn't worked for you. Karen, I need an ADHD drug for me that isn't a stimulant that works. Even Strattera doesn't help. Karen, have you tried Wellbutrin or 10x or guanfacine? Those are often very helpful. Dana, oh, thank you, Dana. Thank you. Let's see. Donna has a question. I know off topic, but can you give me some advice how to help my 12-year-old son who has no empathy and doesn't care about anything, thinks everything is stupid except for his video games and his phone. He has ADHD, ODD, and anxiety. Whew. Yes, I read that a little too fast. Sorry, guys. All right. So it's not that your son doesn't have empathy. I think that kids have empathy. I think that they are, if what you're reporting is he's quite disconnected from himself. So everything is stupid because A, he may not be succeeding at it. B, he doesn't necessarily feel like anyone's on his side. And C, that pattern of vigilance that I was talking about where, you feel like you're messing up, that is what he lives. So we need to sort of break all these things down. Now, ODD, when with medication that works and effective family therapy and treatment, can go away within 2 years. That's what the research shows. So, right now he's 12. So he's just entering adolescence, and he's probably just becoming aware of the ways in which really painfully he may or may not fit in. Video games are a very concrete way to succeed. You reach this level, you go to the next level. And you don't necessarily, and you interact with people if he's doing multiplayer games about the game. You don't have to see people, you don't have to read their expressions, you don't have to observe how you're not fitting in or feel like you've missed out on something someone said. So I think it's important that with him that we start to nurture what he's good at outside of gaming and the phone. What is one thing very small that he can do every day, or that he's already doing every day, that he's doing pretty well, decently enough? Then we want to grow that. Um, if he's good at video games, is he interested in programming? How else is he relating to peers? I mean, when when there's oppositional defiance, it reveals a child's proclivity for aggression, but it also shows that there's um, some discord in the attachment with the parent, some attunement issues. And so I think it's really worth considering if you can find someone to do some family counseling, um, and get him, hopefully he can take some medication that will all kind of turn the intensity volume down. Rachel, do you happen to know anything about anything that's particular to difficulty with RSV as it presents with co-present ADHD and ADHD? So the thing is, you know, kid for people, kids and adults who have ADHD and ASD. So for kids who are diagnosed with ASD, 50% of those kids have an ADHD diagnosis, and research has shown that actually taking some medication for ADHD can lower some of the difficulties, even if they don't meet the full right criteria for ADHD, can lower some of the difficulties related with executive functioning challenges. If you flip it though, of kids for whom ADHD is their primary diagnosis, about 14% of those kids have ASD. So when we talk about RSD, rejection sensitivity, I think a lot of it depends on how where some of the executive functioning stumbling blocks are for those kids or adults, and what are some areas in which those people are functioning pretty well. Again, we want to remember that with rejection sensitivity disorder, what happens is we're over focused on the thing that hasn't gone well, the social interaction that hasn't gone well, and we're under focused on other social interactions that we have in our lives that are going pretty well or that have gone well. I notice a lot of times that kids with ADHD, like they want to be friends with the popular kid. I mean, we all want to be friends with the popular kid. This is super important for these kids because they want to be accepted by other children. And they think the key to that acceptance is being friends and liked by the popular kid. And they will do things to ingratiate themselves to the popular kid, even though they know those may not be good choices, or kind choices. And so we want to really try to think about how to direct our kids to have friends with people who really are friends, to talk about what is a friend. Who are the people in your life where you have some possible juju? I work with this girl, she's an 8th grader, and when we were in really COVID lockdown in the spring, she was so lonely, and she didn't have anybody to talk to on Google Hangouts. She was afraid to reach out to people on Google Hangouts. And so we sat down in our session. I said, okay, let's go through, you have your friends from your elementary school, so you have those 3 friends. Who do you sit with at lunch? And she said, oh, I sit with them. I said, is there anyone else? One person, these other people. I said, are there any of those people who you've had a conversation with? And there was one. So we brainstormed, how do we reach out to that? In homeroom, is there someone you talk to? So we were able to identify 3 additional children, teens, that she could talk to. And she reached out to them on Google Hangout. We brainstormed what to say, like, hey, how you doing? Isn't this kind of it's really hard, this COVID thing? And they responded. And then she started to have some social successes. So often kids need a little help breaking things down and identifying who they could possibly do something with. Thanks, Caroline. And this is Caroline McGuire, and she is an incredible she's just the most wonderful person, first of all, and an expert on social relationships and children. And she's is sharing a video that she's done on YouTube about how to 80 that she did with Jessica from How to ADHD on ADHD and rejection sensitivity. Thanks so much, Caroline. Karen, he doesn't care about anything, then make him work for whatever he wants, even a meal or a bottle of water. I think in this situation, again, I think that having somebody to talk to would be really helpful. Um, I think that, we want to put the have do's and we want to link them to the want to's. So if he has to do some things before the want to's, the gaming and such, then that's the dynamic. What we're looking for now is him actually doing the have to activity. He doesn't need to be pleasant about it. He doesn't need to throw a hissy fit and call you inappropriate names. But if he's making some efforts, if he's participating that way, that would be fantastic. Julianne, is it possible to have RSD without ADHD? This is the only item that seems to apply to my childhood. I've been learning about ADHD with my son's diagnosis. Yes, I think, again, because RSD can be part of other diagnoses, depression, anxiety, I think that is absolutely can be part of it. Didn't help, but maybe I'll revisit them. So Karen, I think in your situation, you want to make sure that you find a family therapist who has experience with ADHD. So a lot of times what happens is therapists will say, oh yeah, I work with ADHD. And then you get in there and they really don't know what they're doing. And this, I'm not proud of this as part of my profession, but I think it's a reality. And so you want to ask people, if you're going to find a therapist, what is your experience working with ADHD? How much training have you had? How many, clients who've struggled with ADHD and ODD and anxiety have you seen? That's important, and that's not you're not being demanding, you're not being difficult. You need to know that information. You're welcome, Ashley. Thank you. Oh, Kelsey likes that Caroline McGuire video, so check it out. What was the book that I just referred to right now? It's in the chat. Just scroll up. It's the book by, I'm not going to go there, but it's a book by Cheryl Strayed. Yes, I'm always here at this time, 4 to 4:45. Come back. Excellent. Great. I'm glad you liked the video also. You're welcome, Donna. Brave Enough by Cheryl Strayed. Thank you. I don't know why my brain isn't grabbing onto that today. And also Carolyn McGuire, I think, has presented for Attitude, and you want to check that out as well. Yes, every Friday I go live at 4. Barbara, we live in Maryland. My son with ADHD has been diagnosed with GAD. He also has some major executive functioning difficulties. He's very bright, but I feel it's time for him to recognize and really work on acceptance of himself, but more so to have a therapist mentor. Do you know of anyone you can recommend in Central Maryland, just north of DC? Thank you, Barbara. How old is your son? I don't offhand, but if you email me, Sharon at drsharonceline.com, I'll put it out to some people I know in that area. And it would help me to know how old your son is. Thank you. Caroline is McGuire, Maguire. Julianne, you're welcome. Also, he has severe anxiety. Okay. Brave Enough. I've been with the same therapist for like 3 years. Nowadays, we're working on me focusing on myself. Great. Annalise, both my mom, something therapist, and our couples therapist have husbands with ADHD, so they're very understanding. Fantastic. Barbara, he's 16. Okay, so yeah, that would be great if you could send me a link. I'm actually taking part in a conference I'm moderating in a couple weeks. It's the CCL conference that's in Maryland, so I'll make some inquiries for you. Yes, my email address is on my website, www.drsharonsaline.com. Okay, I don't see any more questions. Wow, that's amazing. Does anyone have any questions? So let me go to another question here. We all know that those of us who have ADD struggle with guilt, shame, poor self-image, sometimes manifesting in RSD due to our inability to fit into the neurotypical world, and continually hearing negative feedback, frustration, or criticism from those around us who lack understanding of our condition and impacts on behavior. What I'm wondering is how much societal gender norms impact what types of situations or executive functioning tasks trigger your feelings when they occur. So, for example, are women more triggered by not being able to manage domestic tasks than men? So, simply because society is mostly ascribing them. So, I don't know the answer to that, Kelly. I think that's a great question. I mean, I think societal gender norms impact us in so many ways. I also think it has to do with socialization. Women are socialized to get a sense of who they are through their relationships, and men are socialized to get a sense of who they are through what they do. And while that has changed over time, particularly since Carol Gilligan wrote her seminal book, it is still, that has remained fairly constant, and subsequent studies have supported that. So I think, you know, gender society norms and how we're socialized do affect the things that we find upsetting and trigger us. Beth asks, how is it best to motivate and organize yourself to do work you know you really have to be doing, such as external projects or university assignments, when you are already having to balance jobs to pay rent and some form of social life to maintain sanity? Yeah. So here's the thing. Beth, there are three types, in my opinion, three types of procrastination: perfectionism procrastination, avoidance procrastination, and productive procrastination. They're all pretty much what they sound like. You know, we try, if we can't do something right, I'm not going to do it at all. I'm going to avoid this thing because it seems like Mount Everest. I'd rather do anything except this thing. And productive procrastination, which is I I'm going to do other things that need to get done that are smaller tasks. So I feel like I'm doing something, but I'm actually not going to do the main thing that I need to do. So I'm still going to feel bad about myself. So when you have things that you need to do and you're procrastinating, the best thing is to break them down into small parts. So for example, today I made myself a list of the things I need to do. There's like 12 items. And then I made a second list of the things I'm going to do today. That's all. And then I'll come back and I put days on the other list. And then on Monday, I'll take the Monday items, I'll put those on a separate list. Because if you look at a list of 12 things you have to do, it's really depressing. Like it's kind of overwhelming. And when am I going to get all that done? So we want to break tasks down into small chunks. And that will help you feel both a sense of accomplishment, but also progress. Hold on a second. The other thing is that it will reduce a form of overwhelm. You know, the other thing that helps when you have a lot of tasks is to decide the order that you want to do them. So are you someone who likes to do something hard, get it out of the way, then reward yourself with something easy, and then maybe do something medium? Or do you like to do the easy thing first, get warmed up, and then tackle the hard thing, and then the medium? So when you can decide, you know, if I look at my task list, I'm like, okay, well, setting up my schedule, I don't love doing it, but it's not that hard. So I'm going to do that first. So I feel like I'm on my way. Susan, girls with ADHD, inattentive, more tired than hyperactive, yes, and lower energy. How can I get an evaluation of my son to know if my son is RSD? He doesn't seem to have ADHD, but has difficulty making friends. Maribel, how old is your son, please? And difficulty making friends can be a factor of a number of different things, not just RSD. So I need a little more information. Victoria, yes, thank you. Karen, my therapist thought I was on the autism spectrum, but I had another WAIS test and they said I just have anxiety and depression. The doctor didn't see ADHD or anything else. I think of an undiagnosed disorder like BPD, intense emotions and things. Yep, we're all complicated and we can have a number of things going on at the same time. So I'm glad you had the evaluation, and I encourage and support you in all the work you're doing to figure things out. Excuse me. Sharon, how can we tell if an ADHD teen is still working through underlying shame? Teen is gaining mindset, emotional regulation is improving, resilience is building, parents are on positivity. Thumbs up, Sharon. Awesome. So I would basically say that in my practice of, I guess almost 30 years now, I have almost never, so super rarely, met someone with ADHD who doesn't have some kind of shame. They may have worked through it, but they can talk about what it was like for them when they were younger. So I think the fact that your teen is, and I would love to know how old your teen is gaining a growth mindset, and the emotional regulation is improving and the resilience is coming along. This is all fantastic because this will help eventually, you know, fill the bucket with good, um, with positive self-esteem and confidence building statements and activities, and that the shame will slowly get will slowly what will slowly weigh less than all this good stuff. Be outnumbered. um, Danielle, what are some helpful executive functioning exercises that you can suggest to help my 7-year-old with inattentive ADHD? So, I'm not sure what you're looking for, Danielle. I think that for kids who are 7 and they're inattentive, it is hard for them to pay attention. And so I would encourage you to pick one area of executive functioning where they're drifting and just try to work on that. And so uh, often where I would encourage you to start with a young child is on working memory. And I would encourage you to use the rule of 3 that I created. You look a child in the eye, you state your direction, and they state it back to you twice. The first time is to make sure they heard you. The second time it gets encoded in their working memory. So try that and see how that goes. All right, Gab, my girl is 8 and diagnosed last year by a neurologist. School does not recognize she has ADHD. Why not? I'm struggling lots with her behavior lately, calling me names, slamming doors. Okay, so she is been diagnosed by school with autism and she gets OT twice a month, but I feel like this is not really helping. Okay, so again, I don't know where you live, Gab, but I think sometimes people there can be a misdiagnosis of autism spectrum disorder. Instead of ADHD, or people will just diagnose the ASD and they'll kind of pay less attention to the ADHD. My guess is that her behavioral escalation has to do with her frustration and the lack of support that she's getting. So if you're not happy, if you live in the United States and you're not happy with the testing that your school has done, you can request an outside provider to do that testing. That's your right. So I would encourage you to do that. Kelsey. All right. Maribel, he's 12. Okay. So yeah, so he's still kind of a young guy over here, and I think that um, you know, a difficulty making friends for a 12-year-old can be so many things. It can be it can be some social anxiety. It can be maybe not, some depression. It could just be not having tools, like just being awkward and needing help figuring out how to do that. So I think that, if kids are sensitive to rejection, to me the first step would be, actually, I hate to say it, but some therapy, good old therapy with somebody um, who understands if there's an attention order, how to refer for that, but also can do some probing, talking to your son, like, why, what, tell me, just sort of getting to know them. Therapy, a lot of therapy with kids is just getting to know them and hanging out. I have, it so happens in my caseload, I have 3 eighth graders right now. They don't know each other at all. And but what's interesting is that 50% of the therapy sessions are just talking, just in the relationship. And that's kind of what he might need, is just someone to talk to in the relationship, or maybe be in a group, um, perhaps a social skills group. Or I have found that improvisational theater is great for kids who struggle with making friends. Um, Really fantastic. Thank you, Sharon. He's 17. Okay. Oh my goodness. There are 17 more comments. Okay. So it's 10:05. With school being online, it's made it hard to regulate screen time. He has ADHD and loves electronics. Due to this, my 15-year-old has a tendency to go on YouTube and lose track of time. Homework goes by the wayside. Then it becomes time to catch up on homework, and this is increasing his time on screen. Okay, so the thing is, yes, it's much harder to regulate screen time right now. So either, if you can, do family work time where you're in the same general vicinity, so you can get a glass of water and walk past and see what he's doing. If you need to, you can try to put some blocks on the programs. But mostly, what I would encourage you to do is to work with the school to help you with this. If he's going, if he, what's happening is he's in his classroom, he's probably paying attention for like 10 minutes, maybe 15 minutes, and then he's bored. And so he's wandering off into and opening another tab. It is the school's responsibility to engage him, and it is a teacher's responsibility to make sure that he is participating. So I think that what I would set up with him also is that when school is over, that he has a screen break. Do something else. You can sit and do nothing, but you're going to take like a half hour at least screen break, then do some homework, and then he can earn his gaming time. Or you can break down homework periods into like a half hour, and get a half hour of work done, and then you can have a short 5 minute, check your phone, and then another half hour, and then maybe he's done with his homework and he can have his gaming time. Wow, there are so many comments. I don't even know where to begin. Okay, Sherry, you have a 15-year-old daughter and she fights sleep to help with her med management, sleep management, and now struggling. Tips to get her cooperating. So there are a lot of teen questions with online screen management and sleep, just life with teens. So I think maybe we'll see what we can do. Nadia says it only happens during homework. Well, of course, because that's the most boring time. So try to set up some sort of collaborative arrangement with him. You ask him how long he can concentrate on his homework before he needs a break, and then decide what he can do during short breaks. And then if he does 3 15-minute homework periods, he gets a longer break, what he can do during that. Oh, thanks, Dana. I struggled a lot of this. I recently, for the first time, like my job, which is a middle school teacher, it's been super, super tough. To please advise me how I can embrace and continue being a good place. Dana, this is a great statement. Thank you so much for wrapping us up here. We are all in a tough place. We are all in this crazy, crazy, crazy time together. And so what you can do in terms of rejection sensitivity, I think the first thing we have to tell ourselves is, this is not about me. Because when people are rejection sensitive, we take things a little bit personally. I took it personally when that woman said we all don't have to do the same thing. I mean, look, here it is 12 years later. I still remember it down to the detail. Okay? White shirt, dark sweater on top. Like, that's crazy, right? But it was such a striking event, and we remember some of those traumatic events very clearly. For rejection sensitivity disorder, what happens is it's like there's an accumulation. There can be a big event, or there can be accumulation of small traumas, little paper cuts that end up, adding up into a bigger event. So I think the first thing we have to do is to say, I want to make this about me. It seems like it's about me. but I need to remember that we're all having a hard time. So that's the first thing that we need to do. And the second thing that we need to do is for us to be able to say, I'm doing the best I can in a very complicated situation, and everyone else is too. So let me look at this situation. What part of this can I actually acknowledge and be accountable for and own? And what part isn't about me? And that's, I think, the hardest thing for people with RSD or depression or anxiety or anything else, is for all of us to understand, which of this is outside of me and which of this is inside of me. So I wish you all luck in doing that. Thank you for your additional comments. Thank you, Annie, for posting that. It's great to have you. It was really fun to do